Let's talk about ERP for OCD. ERP stands for Exposure Response Prevention Therapy and is used in treating OCD. I guess to the best describe you what ERP is, I will show you an example. So I'll use an example that I used in another video about CBT. So let's say, for example, this person is afraid of touching doorknobs or any kind of handle because they're afraid to get germs, and their OCD basically revolves around cleaning and germs and that kind of thing. So to overcome this obsession using ERP, what the person would do is they would touch the doorknobs on purpose, go to public places and hold public handles on purpose. So what would happen then is the person would over time get less anxious doing these things because they're doing them all the time. The brain gets adjusted and the anxiety subsides. ERP works very effectively. I do find that it's a very aggressive form of treating OCD. So if you are not ready for it, I would suggest starting with something like CBT and then working your way up to ERP. Basically, there's different types of people, and some people like to do things slowly and overcome things slowly, and some people like to do things in spurts. If you're one of those people that likes to all or nothing approach, this is for you. But just know that this is gonna cause extreme anxiety, so it's gonna get a lot worse before it gets better. It's not just like, oh, you're talking and then slowly you kind of overcome it and you discuss things. When you're deciding to sign up for the ERP therapy with your doctor, it's going to be a lot of work on your part. And most of the work will be work outside the doctor's office, because inside the doctor's office, all you'll really be doing is going over the results of what happened when you were doing the ERP exercises. So most of the work lies outside, and it's all going to depend on how much you're willing, how much energy you're willing to invest into this. So if, say, the doctor goes, okay, you have to do this exercise, say, 10 times every day, or 20 or 30 or however many, right, times every day, and then you come back to the doctor the next day and say, okay, I was busy, I was tired, I didn't feel like it, I was too scared, I've done nothing, then your result is going to be nothing. So kind of examine how much energy are you willing to put into it, and how much are you willing to suffer in order to overcome it, OCD. Now, the good thing about ERP is that it works much, much faster than any other OCD therapy. So if you want OCD gone quick, this is the way to do it. But again, you're going to suffer. So it's kind of like if you do CBT, you'll stretch out your suffering, but it's not going to be as painful. Or if you do ERP, it's going to be all at once, but you're going to get very, very fast results. Again, assuming that you are going to put 100% of the effort into it. So I hope this kind of clears up what ERP is. If you have any questions for me, you can always email me at info@youhaveocd.com, or even just leave me a comment below this video, or you can send me a private message through YouTube. Thank you for listening. I hope this has been helpful. If you like it, please click the like button, and please subscribe to my channel. Thanks, and have a great day.